Hi friends, once again welcome back to my channel Mogambiga Nursing. Friends, here we are discussing questions for RRB Nursing Officer exam preparation. In the previous video, we discussed Staff Nurse exam grade 2 question paper and its answers. First 25 questions we covered. Only we are discussing the question and its answers. If you want more explanation means please put comments in the comment box. Question number 25. A recommended dietary allowance of iron for a 15-year-old girl is options. Option A 25 mg per day, option B 28 mg per day, and option C 32 mg per day, and option D 35 mg per day. Question is, according to ICMR 2010, the recommended dietary allowance of iron for a 15-year-old girl child is about 27 mg per day. Option A is the correct answer. Move on to the 27th question. Urge to attain optimum level of performance on valued task is known as. Options. Option A affiliation motivation, option B task motivation, option C achievement motivation, option D normative motivation. Here the question is, urge to attain optimum level of performance or to accomplish a goal or to attain a satisfactory performance to a particular task is known as achievement motivation. Option C is the correct answer. 28th question. Forgetting information because of competition from other learned material is. Options. Option A negative transference, option B conflict, option C interference, option D fatigue. Forgetting information because of competition from other learned material is known as interference. Option C is the correct answer. Next, 29th question. A stimulus that helps one to recall a memory is known as. Options. Option A sign, option B memory aid, option C icon, option D retrieval cue. And the correct answer is option D, a retrieval cue. A retrieval cue means it is a stimulus which helps the people or which help us to recall some memories or long-term memories. For example, some thought of sound, some people things, smell, sight, or some visual images that helps to recall the memories. That is known as a retrieval cue. Move on to the 30th question. The defense mechanism where there is unconscious transformation of unacceptable impulses into exactly opposite attitude, impulses, feelings or behavior is. Options. Option A repression, option B reaction formation, option C introjection, option D intellectualization. And the correct answer for this question is option B, a reaction formation. Reaction formation means it's a type of defense mechanism in which a person tries to conceal his inner motives from himself by giving explanation to just opposite. Okay, so a person is trying to conceal or keeping inside his inner motives and giving explanation to just opposite. That is known as a reaction formation. For example, a politician who is involved in corruption process, he himself gives more explanation about the corruption. That is one of the good example for this reaction formation. First option, a repression. Repression also one of the type of defense mechanism. Here, the person is consciously forgetting his unpleasant ideas, unwanted thoughts or memories into unconscious mind. Move on to the next question. Which type of test is used to predict the extent to which the person can succeed in a particular field of work? Options. Option A attitude test, option B intelligence test, option C aptitude test, option D memory test. Here the question is the type of test which is used to predict whether the person can succeed in a particular field of work is known as aptitude test. Option C is the correct answer. And the question number 32. Which of the following development task is proposed by Erik Erikson during middle adulthood? Options. Option A identity versus role confusion, option B generativity versus stagnation, option C intimacy versus isolation, option D integrity versus despair. According to Erikson developmental theory, the developmental task obtained by middle adulthood is generativity versus stagnation. Option B is the correct answer. Move on to the next question. Process by which the cultural traits spread from one culturally distinct group into another is. Options. Option A, evolution. Option B, assimilation. Option C, accommodation. Option D, diffusion. And the correct answer is option D, diffusion. On to the 34th question. The process of molding and shaping the personality of a human infant is called. Options. Option A, socialization. Option B, acculturation. Option C, ethnocentrism. Option D, interaction. Process of molding and shaping the personality of the human infant is called socialization. Option A is the correct answer. Move on to the next question. The sociogram technique is used to study. Options. Option A, occasional interest. Option B, professional competence. Option C, human relations. Option D, achievement motivation. The sociogram technique used to study human relations. Option C is the correct answer. Move on to the next question. Which of the following is not the basis of natural inequality? Options. Option A, race. Option B, education. Option C, color. Option D, gender. Our question is, among the following, which one is not the basis of natural inequality? Race, color, gender, all are coming in the natural inequality, but education is not a basis of natural inequality. So the correct answer is option B. Move on to the next question, 37th question. Which one of the following is an example of ascribed status? Options. Option A, Brahmin. Option B, student. Option C, teacher. Option D, doctor. Ascribed status means some position or some social status which is assigned to a person at birth. During the time of birth itself, person is getting some position. That is known as ascribed status. Here, correct answer will come Brahmin. Option A is the correct answer. Move on to the 38th question. Which one of the following is an essential element for the existence of the society? Options. Option A, high level of education. Option B, belief in common political ideology. Option C, sociability among the members. Option D, share in the property. Our question is, which one of the following element is essential for the existence or survival of the society? And the correct answer will go option C, sociability among the members. Move on to the next question. Positive trousers and chopstick sign are seen in options. Option A, hypercalcemia. Option B, hyperkalemia. Option C, hypocalcemia. And option D, hypokalemia. Positive trousers sign and chopstick sign are seen in case of hypocalcemia. Option C is the correct answer. And the next question. A nurse identifies that the patient pressure ulcer has just partial thickness skin loss involving the epidermis and dermis. What stage of pressure ulcer should the nurse document in the nurse's record? Options. Option A, stage 1. Option B, stage 2. Option C, stage 3. Option D, stage 4. Here the question is, a nurse is carrying a patient with pressure ulcer and the pressure ulcer is just partial thickness skin loss involving epidermis and dermis. That means it is stage 2. Option B is the correct answer. Partial thickness skin loss involving epidermis and dermis. Move on to the next question. Question number 41. The ratio of KMNO4 solution for mouth care is options. Option A, 1:5,000. Option B, 1:1,000. Option C, 1:2,500. Option D, 1:3,000. And the correct answer is, it is 1:5,000. Option A is the correct answer. Move on to the next question. Question number 42. A nurse to a family member. It sounds like you are really afraid of what might happen to your husband. This statement reflects options. Option A, respect. Option B, sympathy. Option C, empathy. Option D, trust. And the correct answer is, it reflects sympathy. Option B is the correct answer. Move on to the next question. The client's arterial blood gas result shows pH 7.32, partial pressure of carbon dioxide 58, bicarbonate 32. The client experiencing which acid-base imbalance? And our options: option A respiratory alkalosis, option B metabolic acidosis, option C respiratory acidosis, option D metabolic alkalosis. Normal pH of blood is 7.35 to 7.45 and normal partial pressure of carbon dioxide is 35 to 45 mm of Hg and normal bicarbonate is 22 to 27 milliequivalent per liter. If the partial pressure of carbon dioxide is increased and bicarbonate also increased, means this indicate respiratory acidosis. Option C is the correct answer. Move on to the next question. Question number 44. The nurse monitors the patient for reactions after administration of drug. Which reaction has greatest potential to be life-threatening? Options: option A idiosyncrasy, option B toxicity, option C habituation, option D anaphylaxis. Among this, greatest potential for life-threatening is anaphylactic reaction. Allergic reaction is potential life-threatening complication after administration of a drug. Move on to the next question. Dunner's theory of high-level wellness includes the concept of health or illness as it related to an individual's. Options: option A age, option B environment, option C financial status, option D past medical history. It's related to the individual's environment. Option B is the correct answer. Move on to the next question. 46th question. The principal electrolyte present in the extravascular compartment is. Options: option A sodium, option B magnesium, option C phosphate, option D potassium. The main electrolyte present in extracellular fluid or extravascular compartment is sodium. Option A is the correct answer. And the next question, question number 47. Dryness of the mouth resulting from salivary gland dysfunction is called. Options: option A xerostomia, option B chelosis, option C stomatitis, option D dehydration. Dryness of the mouth is known as xerostomia. Option A is the correct answer. On to the next question. A nurse is performing cardiopulmonary resuscitation on an adult client. While performing chest compression, one should compress the sternum. Options: option A 3/4 to 1 inch, option B half to 3/4 inches, option C 1.5 to 2 inches, option D 2.5 to 3 inches. In case of adult client, while giving CPR, the compression depth should be 1.5 to 2 inches. So here the correct answer is option C 1.5 to 2 inches. Move on to the next question. Question number 49. A synchronized breathing with chest contractions during inspiration and expiration associated with multiple fracture ribs. Options: option A paradoxical breathing, option B retraction breathing, option C quizumal respiration, option D stertorous breathing. The question is a synchronized breathing with chest contraction while inspiring and expiration associated with multiple rib fracture is called as paradoxical breathing. Option A is the correct answer. Move on to the next question. Question number 50. The client has an order of 2 tablespoons of milk of magnesia. The nurse converting this to metric system would give the client. Options: option A 10 ml, option B 15 ml, option C 30 ml, option D 20 ml. The question is a client has an order of 2 tablespoons of milk of magnesia. 1 tablespoon is equal to 15 ml. So the nurse should give 2 tablespoons, that is 15 plus 15, 30 ml. Option C is the correct answer. Today we completed up to 50 questions. Next questions we can see in the next video. If it is useful for your studies, please share my videos to your friend circle.